My name is Stephanie Waldrop. I am trained in family medicine, but I practice hospitalist medicine. I'm from Seneca, South Carolina. I went to Seneca High School, then I went to college at Clemson, then I went to medical school at MUSC in Charleston. But I've been gone from South Carolina for a while. I practiced for 9 years in South Bend, Indiana. 6 of those were as a hospitalist, and the first 3 I did my residency there in family medicine. But I'm excited to be moving back home to South Carolina, where I'm from. I chose hospitalist medicine mostly because I like being able to see people coming into the hospital. Most people that are coming into the hospital are very, very sick. It's one of the worst days for a lot of people that they've ever had. And I like being able to see people on their worst day and try to turn that bad experience into a positive one by taking care of them and providing good care and getting them healthy and better and back home and back to their normal lives as quickly as possible. I think what keeps me interested in my work is being able to work with patients. I think more than anything, I'm a people person. I like being able to see patients every day. I like being able to address patients' problems and their questions and their families' questions. And I like being able to interact with them and talk about how they can be partners in their care and how the choices that they make interact with their health. And so I like being able to help patients to understand how not only can I help them to be healthier, but how they can help themselves to be healthier. I really like critical care medicine. So again, as I said before, one of my favorite things about working in the hospital is I get to see patients who are really sick. And I really like being able to take a really very, very ill patient, working through their problems and getting them better quickly. And so I really like doing critical care medicine because I like being able to see those very, very sick patients who sometimes are so ill that they can't even talk to me and interact with me, and being able to turn them around and kind of talk to them a few days later and tell them all about how sick they were and how much better they are now. So. My style of practice, I would say I'm direct. Sometimes part of my job as a physician is telling patients things that sometimes they don't want to hear, but I try to do it in a way that's compassionate. And again, all of that is just trying to help people to understand that the choices that they make really impact their health, and it really impacts how they feel day to day. And so sometimes we have to talk about how the choices that people are making are not good ones, and we want to turn those choices into positive ones so people can feel better. I chose Prisma Health because I really like that it's a not-for-profit health system. I like a health system that is open to taking care of every single patient no matter where they are in their walk of life. I like that they will see any patient regardless of their ability to pay or what their insurance is, because I think that it's a service to the community to take care of every single person. I think every person has a right to health care, and I want to be able to see every single patient. I wish that my patients would ask me more questions when they don't understand things. So many of the patients, when they come to the hospital, they're getting new diagnoses. They're coming in with problems that they don't know anything about, that they didn't even know they had sometimes before they walk in the doors. And so while we try to explain things in a way that patients will understand them, when patients don't understand, I wish that they would just say that out loud. Say, I don't understand, or ask me to explain it differently, because I really want patients to understand what's going on with their bodies before they leave the hospital. The second thing I wish patients would ask me or would ask in general is, before you stop taking a medication, please talk to your doctor about it. When people leave the hospital, they're often on new medications that they've never taken before. Sometimes medications can cause side effects, or they can cause patients to feel poorly. And before patients stop taking them, I really wish that they would talk to their doctor to ask their doctor's opinion. What should we do about these side effects? What can we do to manage it before they just stop taking the medications? And third, I wish patients, again, when they don't understand how to take a medication, or when to take a medication, or with what food to take a medication, I wish that they would ask some of those questions, because we really want to make patients partners in their own health and make sure that they understand all the instructions that we give them, so that once they leave the hospital, they don't have to come back and see me again.